Hello fam, welcome to another beautiful edition of Annie Auto Vlog. If today you face the watching me, you are welcome. So in today's edition, I'm going to be zooming into health. Yes, we're going to be talking about ulcer. What exactly is ulcer? Ulcer, some sores and some holes in your digestive system, in your intestine. So that's what we call ulcer. So there are 4 different types of ulcer. Number 1, peptic ulcer. So peptic ulcer affects the lining of the stomach, the small intestine, and the esophagus. So gastric ulcer affects the lining of the stomach only. Duodenal ulcer affects the duodenum. That means the first part of the small intestine. That's what we call duodenum. Then if you have esophageal ulcer, that means the ulcer affects the end part of your esophagus. That's what we call esophageal ulcer. Again, we have 4 different types of ulcer. Peptic ulcer, which is the most common. So a lot of people that have ulcer have peptic ulcer. That means it affects the small intestine, the stomach, and the esophagus. What exactly are the causes of ulcer? What exactly makes people to start suffering from ulcer? Because this is a very common disease. A lot of people have it, and ironically, some people think they have food poisoning. Number 1, increased secretion of the acid in your stomach. You know, the acid in your stomach is supposed to be in certain level. When you have increased secretion, it can cause ulcer. You start having some holes and sores in your intestine. Number 2, decreased mucus secretion that protects the stomach lining. So when your stomach is no longer producing this mucus that protects the stomach, the acid that is produced in your stomach then will overcome it and they start irritating your intestine. Number 3, infections. So there is this bacteria we call H. pylori. So H. pylori is a bacteria, and how we get this into our system is by the water we drink, the food. That's the mode of transmission. It goes there and start irritating us, start having all these sores and holes in our intestine. Number 4, by taking certain medications. There are a group of medications we call NSAID. So these are medications like aspirin, ibuprofen, naproxen, etodolac, meloxicam, Celebrex. All these medications can cause the intestine to be irritated and it to start having all these holes and pores and sores everywhere. Another one can be steroid. The steroid you take, medications as well, can also cause these problems. Anticoagulants can also cause this problem. What are the signs and symptoms of ulcer? Number 1, abdominal pain and cramps. You start having a whole lot of cramps and pains in your stomach. Sometimes it's so unbearable that some people have to be admitted in the hospital. Number 2, nausea and vomiting. You start vomiting, having a lot of urges to vomit. You may even vomit blood. Then another one, excessive or passing gas anyhow, is just whoop, whoop, whoop here and there. And another one, you have this burning sensation like there is fire in your stomach, in your intestine, there is fire, is burning. Another one, some people will start having bloody stools. That means when you poop, there will be blood in your stool, or your poop looks black. That means I've already mixed with poop. That's why it looks black. So that is not good. Go and see your doctor. Again, the signs and symptoms: abdominal pain, nausea, vomiting, including vomiting blood, passing of excessive gas. That means excessive. It's not just passing gas, but excessive gas. Number 4, burning sensation in your intestine, in your stomach. Number 5, blood. That sign that you might have ulcer going on. How do we treat ulcer? If somebody happens to have ulcer, you know, you go to the doctor, they diagnose you, or you have symptoms that you want to take something over the counter and see if it will help. Number 1, you're going to have some antibiotics. Remember that I told you that H. pylori causes stomach ulcer. So the doctor will give you some antibiotics that will help you kill that bacteria that is in your stomach. You know, examples of these antibiotics might be maybe ordinary amoxicillin will help, clarithromycin will help, Flagyl will help, tetracycline will help. Then another medication you can take is what we call antacid. So this antacid would decrease the production of acid in your intestine. Something like Tums, Malantan, magnesium hydroxide, calcium carbonate, Melos, all of those ones will help to suppress or to decrease the production of acid in your intestine. Another medication that you can take is what we call histamine receptor blockers. So these are medications that will also suppress or decrease the production of stomach acid. Something like Pepcid, Tagamet, they will all help, okay? Another set of medications that the doctor would like you to take is what we call proton pump inhibitors. So these are medications that will also decrease the release of acid in your stomach. It will just suppress it, decrease it. Examples are something like Protonix, Prilosec, Nexium, Pravacid. All of these medications will help a lot. Another set of medication, because some people, when they have ulcers, it comes with diarrhea. So we also recommend anti-diarrhea if you're having diarrhea. So most common medication for anti-diarrhea is Imodium. It's over the counter as well. Or you can take Pepto-Bismol, the pink liquid medication. Not only that, it will stop diarrhea, it can also coat the stomach lining and also relieve the pain, the cramps in your stomach. So Pepto-Bismol is a way to go. Very, very nice. Then another one you can take, things like probiotics. You can buy probiotic supplements in the store, something like the Bacillus. Make sure you buy the ones that said 1 billion, that one is very, very good. Anything lower than 1 billion is not going to be good, okay? Then another thing you can take are food that will increase the probiotic in your intestine, some bacteria that are meant to live in your intestine. We call it normal flora. So there are food that will help you maintain all of this. Food like yogurt, not all these sweetened yogurt, natural yogurt, things like Greek yogurt, they are unsweetened, so those are good. Pickles are good. Avocado, almond, mangoes, oats. You can do as a treatment changing your lifestyle. Lifestyle management is a way to go. So if you used to drink a lot, please, you need to stop drinking alcohol. Not water. Alcohol, anything alcoholic. If you have stomach ulcer, it's a no, don't drink alcohol. If you smoke and you have stomach ulcer, stop smoking, quit smoking. Anyway it is, smoking is not good for your health. Is it caffeine? Stop taking caffeine. It's going to irritate your intestine. Eat on time, okay? This is a biggie. I know some people do some, mini fasting or a lot of fasting and all those stuff. That's good, but do not over fast. Do not take so many days of fasting, dry fasting. Don't skip breakfast for so long. You can drink a lot of water, a little bit of tea, a little bit of this and that, just a little bit. But do not stay hungry for the longest time, not in the afternoon, not at night. Anytime if you're hungry, those acid will start eroding your lining, the normal lining of your intestine, and that will expose your intestine to ulcers. Avoid certain food if you have ulcer. You got to avoid certain food. So food that are spicy, let's say all this chili pepper, habanero pepper, hush bonnet pepper, all these things, or any pepper that is hot and spicy, please avoid it. If you have ulcer, you can survive without pepper, okay? So please avoid hot, spicy food. Avoid any food that is high in acid, any citrus fruit, tomatoes, fresh tomatoes, avoid it, okay? I'm not saying you should totally not eat certain things, but minimize to the lowest level of it. Greasy, fatty food, avoid it. Carbonated drinks, any drink that you open it to go pop and you see effervescent, avoid it. That's carbonated beverage, okay? Chocolate is not good for people who had ulcer. highly seasoned food that have a lot of spices, seasoning, avoid it. Eat healthy. So with fruits, vegetables, bell peppers, carrots, garlic, onion, berries, blueberry, blackberry, strawberry, all those berries, they are good for you. Whole grains, oats, they are good for you, okay? Again, food that are high in fiber, dry beans, stick to them and avoid those ones that cause you a lot of problems. Another way people can treat this is by having surgery. If it goes to that level of having surgery, that means you have run into complications. So some of the complications that are possible with ulcers are perforation. That means that particular area is not only having holes or sores, it has busted. Another thing people can encounter is bleeding. So when those ulcers are a lot or have been perforated, you will see yourself bleeding. When you go to bathroom, it's all bloody. Then another one is narrowing and blockage or obstruction of the opening to the duodenum. Avoid stress or lower your stress level, because this can also cause you another problem. So this is the much I have to discuss about ulcer. Share this video, like, comment. I really appreciate your thank you. Stay safe. I'm your girl, Annie Otta. Bye guys.